How is sleep apnea diagnosed in myotonic dystrophy? Have you ever wondered how sleep apnea is identified in individuals with myotonic dystrophy? This condition can complicate the diagnosis of sleep apnea, making it essential to understand the process. First, a clinical evaluation is crucial. Patients with myotonic dystrophy are often assessed for common symptoms like snoring, disrupted sleep, and daytime fatigue. Interestingly, many individuals may not report significant excessive daytime sleepiness, even if they have sleep apnea. To get a clearer picture, healthcare providers often use sleepiness scales. One popular tool is the Epworth Sleepiness Scale. This scale helps to quantify daytime sleepiness. A score above 10 usually indicates excessive sleepiness. However, in myotonic dystrophy patients, sleep apnea can still be present even with lower scores. The gold standard for diagnosing sleep apnea is polysomnography. This test records various physiological parameters during sleep, such as breathing patterns, oxygen levels, and brain activity. In patients with myotonic dystrophy, polysomnography often reveals obstructive sleep apnea, central sleep apnea, or a mix of both types. Another important aspect is the apnea-hypopnea index. This index measures the severity of sleep apnea by counting the number of apnea and hypopnea events per hour of sleep. In myotonic dystrophy patients, hypopneas, which are partial reductions in airflow, tend to occur more frequently than apneas, which are complete cessations of airflow. Additional assessments may also be performed. Tests like spirometry and arterial blood gas measurements during the day evaluate lung function and gas exchange. However, these tests alone are not reliable for screening sleep apnea in myotonic dystrophy. Family history plays a role in the diagnostic process as well. Since myotonic dystrophy is a genetic disorder, a family history of both myotonic dystrophy and sleep apnea can raise suspicion. This may lead to earlier or more thorough evaluations for sleep apnea. Diagnosing sleep apnea in individuals with myotonic dystrophy is vital. Sleep apnea can contribute to respiratory failure and negatively impact quality of life. Routine polysomnography is recommended for myotonic dystrophy patients, regardless of their daytime sleepiness levels. This approach helps detect sleep apnea early and guides appropriate treatment. In summary, diagnosing sleep apnea in myotonic dystrophy involves a combination of symptom assessment, sleepiness scales, and primarily polysomnographic studies. This thorough process ensures accurate detection and management of sleep apnea in this population.